If you're a nursing student, you know there are certain skills you've absolutely got to master, not just for your clinicals, but to crush the NCLEX. And today we're diving into one of the big ones, the apical radial pulse deficit assessment. Trust me, this is way more than just counting. It's about finding major clues about your patient's heart health. We're breaking down key nursing topics just like this every single week, so make sure you subscribe and ring that bell so you never miss an explainer.
Okay, let's get into our breakdown for today. We're going to walk through this skill in a way that should feel really familiar, because it basically follows the nursing process. We'll start with what a pulse deficit even is, then how to get ready, how to actually do the skill, and probably most importantly, what it all means and what to do next.
So first things first, what are we even looking for here? You've got to think of a pulse deficit as more than just a number. It's a critical diagnostic clue. It's a piece of the puzzle that tells a story about what's really going on inside your patient's body.
So here's the official definition. A pulse deficit is simply the difference between the apical pulse, that's the one you're listening to right over the heart, and a peripheral pulse, which is usually the radial one on the wrist. Now, the most important word on this slide, without a doubt, is simultaneously. You have to measure both pulses at the exact same time, or the number you get is meaningless.
Okay, let's talk about prep. Any nurse will tell you, the stuff you do before you even touch the patient is just as important as the skill itself. Setting up correctly for safety and accuracy, it's totally non-negotiable. So, what do you need to grab? Well, each piece of gear has a job. You need a watch with the second hand so you can time it for a full minute. You need your stethoscope, obviously, to hear that apical pulse. It's also smart to have a Doppler on hand, just in case you can't feel that peripheral pulse. And of course, gloves and any other PPE you might need. Think of this as your pre-flight checklist. Every single step here is about safety. First, you check the chart to see why you're doing this and to look for things like allergies. Then you grab a partner. Remember, this is a two-person job. And then you do the fundamentals. Provide privacy, wash your hands, and of course, the classic, confirm your patient with 2 identifiers. All right, we are prepped and ready to go. Now we get to the heart of the matter, literally. Remember, you're not doing this alone. This assessment is all about coordination and teamwork. This slide lays it out perfectly. It's all about division of labor. One of you is on apical duty, listening with a stethoscope. The other person is on radial duty, feeling for that pulse. And you are both counting for 1 full, synchronized minute.
Let's break down the job for caregiver number 1. Finding your landmark is everything. You're going for the 5th intercostal space at the left midclavicular line. That's your sweet spot for hearing the heart clearly. You want to press that stethoscope down firmly to get a good seal, which helps block out extra noise. And remember, each lub-dub sound is just 1 beat. Count them for 60 seconds.
Now at the same time, caregiver number 2 has a job that's a bit more straightforward, but just as important. You're going to find that radial pulse on the inside of the wrist, right below the thumb. The second your partner says go, you start counting every beat you feel for that exact same 60-second window.
And here it is again, because you absolutely cannot forget this. This is the golden rule of this whole assessment. You could do everything else by the book, but if you don't count at the exact same time, your result is totally worthless. One person needs to be the designated timekeeper and say start and stop so you're both on the exact same page.
Okay, the skill is done. You've got your 2 numbers. So, now what? This is the most important part. This is where you stop being just a technician and start being a clinician. You have to take this raw data and figure out what it's telling you about your patient.
First things first, let's set our baseline. For a healthy adult, we expect to see a pulse somewhere between 60 and 100 beats per minute. So this is the normal range you're always comparing your numbers to. So what's the deal when your 2 numbers just don't match up? What is a deficit actually telling you? This is the key takeaway right here. If your radial count is lower than your apical count, that's a pulse deficit. And what it means is that the heart is pumping, but for some reason, not every single one of those beats is strong enough to send a wave of blood all the way down to the wrist. The heart's working, but it's not working efficiently. So what kind of problems can cause this inefficiency? Well, there are a few big ones. Atrial fibrillation, or AFib, is a classic culprit. Those irregular, weak heartbeats often don't make it out to the periphery. But it can also be a sign of other serious stuff, like coronary artery disease.
Now, listen up because this slide is critical. If you find a pulse deficit and your patient has any of these other symptoms like chest pain, dizziness, they're all sweaty, or their skin is looking bluish, this is not just a routine finding anymore. This is a potential emergency. You need to notify the provider immediately and get ready to help with whatever interventions are needed.
We're in the home stretch now. You've done the skill, you've interpreted the data. The last piece of the puzzle is all about being a professional, documenting what you found the right way, and making sure your patient is safe before you leave the room.
You really want to pay attention here because using the right words is so important for good communication and for your exams. If that apical pulse is over 100, we call it tachycardia. If it's under 60, it's bradycardia. And for the pulse deficit, you chart it as a specific number. You'd write something like apical pulse 98, radial pulse 88, for a pulse deficit of 10.
And finally, before you walk out that door, you have to run through your safety checklist. This is just fundamental nursing. But the call light where they can reach it, lower the bed all the way down, lock the brakes, and make sure things like their water or their phone are right there. It's all about keeping your patient safe and comfortable.
So let's wrap up with this thought. The apical radial pulse assessment is the perfect example of how a basic nursing skill, when you do it right and you think critically about the results, can tell you so much. It turns two simple numbers into a massive clue about your patient's health. So the real question is, what will your next assessment reveal?
Hey, if this explainer helped you get a better handle on this skill, do me a huge favor and hit that like button. And for sure, share it with your study group and your friends in class. We can all use clear, simple reviews like this. And if you're looking for more review material to get you ready for your exams, definitely check out the links in the description below. We've put together some awesome summarized NCLEX revision books for all your nursing courses, all designed to help you study smarter, not harder. Thanks so much for watching, and I'll catch you in the next explainer.